There is no let-up. The cubicles here at the emergency department in Warrington were full hours ago. New arrivals wait in whatever space is left. Liam was admitted this morning after he was in a car crash. It's late afternoon now and he's still waiting in the nurses' station until there's space on a ward.
They've just came back at the CT scan and said I've got a bruised lung, bruised left lung.
For the medics, the day blurs into a constant rush, making sure everyone gets treatment, eventually.
For the last hour, we've had 2 trauma calls, we've had a very sick patient in cardiac arrest, and we've also had 2 COVID-positive standbys. So that's typical of what we're seeing now and what we have seen over the last couple of months.
This is just a snapshot of the stresses weighing down on one emergency department. But it is a similar picture in many places across the country.
This is where the ambulances come in. As you can see, it is extremely busy. Now, on a normal day, if they're treating 50 patients at any one time, it's considered busy. At the moment, there are more than 100. You see people lined up in the corridors waiting to be treated. And the fear is, as the weather gets colder, the situation will get even worse.
In a cubicle, waiting patiently, we see Ben Aston. He arrived with chest pains hours ago. He came here because he couldn't get an appointment with his GP.
I understand with the current situations going on with COVID and things like that, and patients being socially distanced, and you can't have family sitting in the waiting room with you, you're more or less on your own. It is hard.
Increasingly, when one part of the NHS isn't coping, it's accident and emergency that's taking the strain.
There is a large amount that traditionally could have been seen in primary care, but at the same time our colleagues are seeing a lot of things that could also have been seen in secondary care, or if they'd had their routine investigation, surgery.
Waiting times from A&E to a ward are now longer than ever, and it is particularly bad here. Patients waiting more than 8 hours, 70% longer than the national average. The pressures of winter and what feels like an endless pandemic are now acute.
We always say, if you become overwhelmed, your resource becomes overwhelmed, you declare a major incident. It almost feels like we're always right on the edge of a major incident. So you might say, well, why don't you declare one? Well, the reality is we'd be doing it every day.
How are you feeling today?
Elsewhere, the pressure is just as great. On this ward, they're seeing an uptick in respiratory illnesses. But they're also concerned about the new variant, Omicron.
There's a very difficult mix of COVID still going on, new variants coming which keeps us on our toes, and our immense winter pressures mixed in with other respiratory illnesses. So yeah, it's a really hard place to be right now.
No one here knows what will happen over the next few weeks and months. But as winter begins, it's clear the healthcare system is already struggling. Alex Rossi, Sky News, Warrington.